Hi, welcome to today's episode of Clinical Masterclass with Dr. Aditya. Today, we shall be learning about the per abdominal examination of an obstetric patient. The first part of any examination is to take the patient's consent. After that, you warm your hands so that the patient is not at discomfort. Then, there are three aspects of examination that we shall be doing, namely inspection, palpation, and auscultation. Percussion is not done in these women because of the gravid uterus, wherein we can't percuss anything. So, in the first part of inspection, we see that the abdominal contour is distended or globular. It is an even distension or an even globular surface because of single pregnancy, which would have been multiple lobulation if it was a twin pregnancy. After that, I shall be seeing the umbilicus and its shape. Over here, you can see that it is lying flushed to the surface of the abdomen. The other pathological variant can be it bulging out or a swelling because of umbilical hernia in previously operated women on the abdomen. The third part of it is going to be seeing the linea nigra, which you can see over here in the center. It's hyperpigmented line which lies in the center, and lateral to it are the stria gravidarum or the stretch marks. Then I shall be seeing whether there are any scars over here. You can see there is a fan and steel scar because she has been operated earlier. She has had an LSES done earlier. We'll also see that there are no sinuses that are visibly present on the abdomen. Once we are done with that, we shall proceed to palpation. And the first step of palpation is going to be centralizing the uterus. I do this by putting my both hands on both sides of the abdomen and correcting the uterine dextrorotation. Once I'm done with that, I shall be asking the patient to keep her legs extended for doing the symphysiofundal height. Over here, I check the length between the pubic symphysis and the tip of the uterine fundus. After I'm done doing that, and I have to take a measuring tape with the inch side facing towards me. Then I measure the length wherein I confirm the tip of the fundus using the ulnar border of my left hand, as I can see over here. Once I'm done doing that, I measure it using the inch side, and then I overturn the tape to see the side of the centimeter. This tells me over here you can see that it is 33 centimeters in this pregnancy, which is otherwise of 37 weeks. There is an evident point of fetal growth restriction that can be seen over here. Once I'm done doing that, I'll ask the female to flex her legs, and the rest of the examination has to be done with flexed legs so that the rectus muscle is not stretched. The second point of palpation is going to be doing the Leopold's maneuvers. The first Leopold's maneuvers, or what is also called as a fundal grip, is where using both my hands and facing towards the feet, towards the patient's head, I check the uterine fundus and see what is the part of fetus that is lying over there. If it's a ballotable hard structure, it is going to be the fetal head, whereas if it is an irregular structure that is non-ballotable, it is going to be the fetal buttocks or the fetal breech. After that, I shall be going for the second Leopold's maneuver, or the lateral grip or the umbilical grip, wherein I shall be palpating for a board-like rigidity, which over here is on the maternal left. That is the fetal back, whereas on the other side, I can feel knob-like structures which are the fetal limbs, as are seen over here on the maternal right side. So on the maternal left, there is the fetal back. The third grip is going to be the third Leopold's maneuver, or the Paulink's grip, or the first pelvic grip is going to be me trying to see or rather confirm the findings of the first grip. Over here, I can see that there's a hard ballotable structure. Also, I can check for scar tenderness in women with previous cesarean section. It also confirms that the fetal head is lying in the lower side of the abdomen and is the presenting part. I also get to know whether the head is engaged or not because the head is easily ballotable over here. Finally, for the fourth Leopold's maneuver, I shall be facing towards the patient's feet, and using both my hands, I shall be seeing whether my hands can converge over the fetal head. If they converge, which is basically if they meet, it indicates, as in this case, that the head is not engaged. Whereas if they are divergent, it indicates that the head is engaged and I cannot get over the head. And this is how I shall be doing all the four Leopold's maneuvers for palpation of the abdomen in an obstetric patient. The final aspect of examination is auscultation, which can be done with the fetal handheld Doppler or the bell side of the stethoscope. It is put over the spino-umbilical line to hear the fetal heart sounds. And hence, this is how we do the per abdominal examination of an obstetric patient.